India today stands at the crossroads in terms of public health. It is witnessing a dual burden of diseases such as communicable and non-communicable. The determinants of good health are multiple, ranging from a broad array of individual factors to a wide spectrum of societal influences. Leadership at various levels has a vital role to play in the health delivery mechanism. Developing and sustaining leadership at all levels in health sector has become imperative. Throughout the history of mankind, exceptional leadership qualities have been displayed in different areas of human endeavor. In the early history of mankind, the choice for leadership must have fallen on the shoulders of the fittest and the strongest. However, with the gradual development of modern civilization, soft skills, which are more mental than physical in nature, become equally important. In India, the role of the doctor has changed from one of presiding deity to that of a manager in recent times. The growing complexity of activities in the health sector today makes leadership skills an integral part of its management.
In the journey of exploring what makes a good leader, we have gone through the literature. We examined different health leadership frameworks, then we identified key validated questionnaire. Then we used this questionnaire as a signpost to interview some of exemplary leaders. Then we asked, the first question is, what makes a good leader?
Who is a good leader?
Leaders are people who communicate a clear vision, clear direction, and a clear intent for their own organization or how they wish to take a certain task or a responsibility or a strategy forwards. I think that's part of leadership.
Leadership, in my understanding, means helping people around you to discover their own potential, and when we all work together on a certain task, to increase people's sense of ownership and involvement. And I feel leaders' main role, therefore, is enabling and empowering people around them to do better and to reach commonly accepted goals.
For me, a leader is a person who has a clear vision. There's a clarity in communication, delegation of the work that is ahead of them, and perhaps the most important is the empathy on the personal and the professional front with the members of the team, of which the leader is also a constituent.
The literature also conveys that the simplest definition of leadership is to influence the people. As a leader, it is very important to be able to conceptualize a realistic vision.
That a good vision would be to try and serve the Andhra Pradesh public health priorities. Now that's a vision around which you could actually get a consensus. Andhra Pradesh government in 2008 had several priorities. The first thing was to get public health skills and capacity built very quickly within their public health system. So we could certainly offer teaching skills and competence, our research and evaluation competence, our advocacy competence within this institute and within the team to immediately get going.
The Society for Community Health Awareness Research and Action, which I co-initiated along with many colleagues when we moved beyond the medical college, was based on an experiment to try out this whole idea of collective participatory leadership rather than more individualized iconic leadership that you find in biomedical or institutional type. And we found that the sorts of leadership styles that we were familiar with in more hierarchical and more technical institutions, which focus more on individual skill and capacity rather than on collective processes, needed to be looked at differently. And therefore the whole society and the whole cell that we started was based on trying to understand this new phenomena.
The literature we consulted says that one has to do vision audit to get clarity of vision for an organization to set realistic goals. Developing leaders is more important than followers to grow an organization.
So we started this process of getting young people to join us and to reflect on some of these issues, not only of leadership but about society and about development, health, but also we built in a mentorship of a different type. One was mentorship by us during their stays in Bangalore, where we mentored or facilitated a process of learning together. But the other thing was we found out very good projects all over India, both in the NGO world as well as in the both in civil society and in government, where people were achieving things, people were doing things, people were leading teams towards certain measurable goals and impacts, and we began sending these young people to work for two months with them. So our 6-month fellowship consisted of two-month postings with a very inspiring field mentor, and 2 months in small, sort of week, 6 weeks, 4 weeks, 2 weeks like that, discussion about what we can learn from each other.
I enjoy putting teams together where junior and senior people might need to work together. And that's great learning because for the junior people to see how senior team members do things is good learning. However, junior people might have some perfectly good ideas which the senior people haven't thought about, because no one person has the monopoly on all the best ideas.
So we started a school. This was the first generation learners. In this school, with the 6 children I started, out of them 4 have become postgraduates. And Jadia, who is the president of VGKK now, he is did his MSc Agriculture and completing his PhD, is assistant professor in a forestry college. So it has been a long process, and now about 500 children study in the school.
Conflict resolution is an integral part of leadership role. We wanted to know how leaders address conflicts in their organizations.
Managing their interpersonal conflict with a lot of compassion and giving space for individuals to let their steam off is extremely important. Another important thing that I have learned is that in conflict management, do not pull up somebody in front of the entire group. It is always counterproductive. Always call individuals to your chamber, take them out, speak to them, ask about their problems, solve it on a one-to-one basis, and the individual with whom they have a problem, bring that individual in at a later stage when you have talked to the first individual.
I didn't have any classes on conflict resolution. When you have passion, and when also I have the problems, sometimes we exaggerate. There are problems which can be solved at that level. But sometimes to solve and find solutions at that level, you need to go to a higher level. I have problems in my family, my own problems. When I look at the entire family, my problem becomes less. There are conflicts at each level. A view, overview, and a larger framework, looking at from a broader perspective, gives a new dimension of resolving that conflict. We should not be narrow in looking at it, and allow the local people to decentralize it, and they can find solutions to solve it. And most of the problems now they get solved. Only we need to get in there when they cannot resolve, and again empowering them, assisting them can solve these problems.
My experience, as being, if you consider it as an effective leadership, has been to resolve a conflict by helping people to identify the issue, the system defect, rather than the individual aspect of the problem. By focusing on the individual, we sometimes create different sort of psychological, social and other sorts of conflicts, and we increase the conflict. So my feeling is that you should always, give you an example. If you as a leader went to the field and you found a health worker was not doing something, you could either see the health worker as the problem, or you see the health worker not being able to do something as a problem of supervision, as a problem, a lack of supervision, as a problem of failure of logistics, which is why he is not able to do, or he or she is not able to do, or a failure of lack of learning. My feeling is that conflict resolution should be system resolution rather than individual blaming and individual resolution.
The everyday world of public health is full of challenges. How do leaders address such challenges? Dr. Sudarshan tells us how he developed a model, PHC, in BR Hills for the tribal Soligas.
So we took one primary health center in the most challenging, what I call Bhimaru districts of Karnataka in northern Karnataka. Those challenges were much bigger, difficult to get MBBS doctors, very, very difficult, and good trained staff. But we took those challenges, and now we have established one in most of the districts in Karnataka, except where HDI is more. So from curative health gradually moved into community health. And when I don't have pills for poverty, there were a lot of issues of exploitation of the tribals. Land alienation was a major problem. They used to put their thumb impressions and get the documents in their favor. So I had to fight for the land rights also. In the process, I was in jail for 2 days fighting for the land rights. But thanks to the good bureaucracy which helped, one Madan Gopal IAS officer helped, and we got back the land for the tribal people.
Now, let us examine a case of exemplary leadership that not only created an organization but ensured the success of it. Dr. Sudarshan took it upon himself to create state-of-the-art health facilities in a backward region. Piligiri Rangana Hills is home to the Soliga tribals with subsistence living. Karuna Trust was set up in 1986 based on the experience of Vivekananda Girjana Kalyana Kendra from BR Hills. The primary objectives of the Karuna Trust were to provide integrated development to the poor people and organize and empower them to be self-reliant. To achieve this goal, the Ministry of Health handed over the management of a PHC in Gumballi, Chamrajnagar district in 1996 to Karuna Trust. Karuna Trust introduced several innovative concepts and programs to provide people-oriented, community-based, cost-effective primary health care. These include promotion of low-cost generic drugs and rational drugs use, and a well-equipped mobile dental health unit, training of community mental health personnel to provide services, early mental illness diagnosis, and management of epilepsy cases. Telemedicine facilities are provided in collaboration with ISRO. A report from a cardiologist at Narayana Hrudayalaya can be obtained in 5 minutes. A trained refractionist and optician can diagnose and identify refraction errors and provide spectacles at affordable prices of around 100 to 120 rupees. Karuna Trust also provides basic lab services such as HB, RBS, malaria, and sickle cell disease detection. The staff has also been trained to take pap smears for early detection of cervical cancer. Community Health Insurance Scheme, in collaboration with UNDP and National Insurance Company, has also been offered at low premiums, including wage loss compensation. Success does not come always. Failure does come often. The strength of leadership also lies to handle the failures. Handling failures teach new lessons.
One should be very careful that something happening or not happening, or something being gained or not gained, is not the only indicator for success and failure, but whether the team learns from it. Because it is as we learn more and more from experience, even if you look at a thing like epidemic, as we have tackled more and more epidemic, we become better and better skilled, we better understand the complexity of each epidemic. And no doubt today the epidemics are itself becoming complex, but the only way we can tackle them is by not just more money or more material or more human beings, but more understanding from past epidemics. And to me, every failure can be the starting point for a success, because learning from that failure will ensure that the next time we do the same thing, we will succeed in.
Success and failures are part of the game. I still remember when I received the alternate Nobel Prize Right Livelihood Award in Swedish Parliament. At that moment, I also remember the 2 days I spent in jail with the tribal people. When I was arrested for that land issue, I went on total fast like Gandhian fasting. So that experience and receiving an award when everybody is praising you, I don't see much difference. Both are equal for me. I learned something while fasting in the jail and also awards.
Everything that you do is not going to succeed. Success comes through a series of experimentation, a series of steps when you're experimenting. And when you experiment, there is bound to be failure on some occasions. An example that I'd like to quote is that when we started these community outreach, we did not have much of funding available. So we used to go there, do a refraction, and after the refraction, prescribe a pair of spectacles. When we did an evaluation 6 months down the line, we found that there was hardly 2% uptake of spectacles. So that was a failure. So the method in which we had actually delivered services was not meeting the objectives that we had set for ourselves. So we learned from our failures and then modified them to try and improve the situation.
What I have found from my experience is failures are because of our mistakes, our inexperience, our lack of knowledge, or lack of skill. We have to always sit. Of course, initially as a human being, we may feel depressed or we may not be able to accept it. If not at that juncture, at least if you are not able to rectify the mistake later on and learn from our mistakes, I think we will never be able to lead any other people.
We wanted to develop modern agriculture in tribals. Give them, that was the moment at that time, give them hybrid seeds. Why are they producing less? Let them give very high things. And now we have gone one way around. We all know organic farming is very good. What they were practicing is good. We dump them with pesticides, tons and tons of sprayers were given to them. But fortunately, tribals had the wisdom. They refused to accept it from the government. And they never put chemical fertilizers or pesticides. And now I am happy, which we thought, I was also part of that. We probably have to show them high yielding varieties and they must produce more. Now I am fully convinced that traditional methods of organic farming, conserving traditional seeds, maybe production is less, the quality of food is good, is much more relevant than this commercialized market-oriented agriculture economy.
Successful leadership is also about delegating work. Not delegating because of fear of losing control, poor work, lack of trust, etc. leads to poor leadership.
I definitely believe in delegating power and trust and responsibility to people within the organization. I think the key to this is being very clear about what the outputs are that you expect of people. You're not asking them to do things which is beyond their own capacity. So it needs to be a process by which these goals are mutually agreed. But then you can also get people to push themselves a little bit further than their own comfort zone. And that's great. And I think another important thing is that you need to recognize people may make some mistakes when left alone to get on with things. And you must accept that there might be some small mistakes made, or they might not do it exactly the way you want it done or you would do it. We're not clones of each other. They'll find a different way of doing things, but you need to trust them.
The most important stages of delegation, according to literature, is assignment, authority, accountability, and affirmation. Nevertheless, balancing is important in different occasions. It takes diverse skill sets to build an organization. As leaders, one should develop cultural competency to address diversity in manpower.
So doctors just see HIV/AIDS as a viral problem that maybe needs ARVs or condoms, whereas those, if you see HIV/AIDS as a social issue, as an issue of irresponsible sexuality, as an issue of life skill education for adolescents, as an issue of stigma and discrimination, then tackling HIV/AIDS becomes a much more a sort of a wider multidisciplinary, multi-sectoral sort of approach. To understand that and lead people in that direction, you must as a leader understand it that way. So the whole idea was to get people to begin to be multidisciplinary, to be plural about their understanding of society.
Diversity from the point of view of education, it could be diversity from the point of view of cultural groups from which the team is drawn, but all of that means that you have a very rich pool of ideas. I think reinforces the individual ways of doing things and makes a bigger difference than individual team members would have done, or a team which is monocultural.
Leaders should lead from the front and provide motivation to all the others based on their individual competencies. It is both an art and science to pick the right approach for each individual.
Motivation is not about telling people to do this or that or exhorting them to do or so on, but really getting rid of the obstacles around them that prevent them from being able to manifest this potential. So the focus again is like focusing on the system that allows innovation, that allows creativity, and automatically motivation will rise. So you find in systems that are very hierarchical, very controlled, very led by top level leadership, creativity goes, innovation goes, a sense of ownership goes, and people get demotivated. I think other people around us are like signposts. In that sense, they tell you, they show you some way, but they don't necessarily have to mean that that's the only way. I'll give you an example. We have told people always choose enthusiasm, not security. As soon as you find your area of interest, security will follow, because you're so secure in your area of interest that automatically it will come. But if you get into security, thinking leadership is all about reaching some place, which is a position and prestige, a lot of our leaders today are very insecure people because they have nothing to offer. They spent all their time reaching there, and having reached there, they don't know what to do, because their reaching there was the passion, not doing something to reach there. So you find a lot of people, so they are all the time frustrating other people, bossing over people, and not lighting more candles, giving more freedom. All our programs would improve if everybody in that team, from the Director of Health Services up to the Anganwadi worker, felt that they were part of their pulse polio program, their malaria program, their primary healthcare program, their NRHM. At present, most of these are someone else's. Some of those are not even Delhi inspired, they are Washington inspired, Geneva inspired.
For any leadership, leaders, that's where Mahatma Gandhi is, my life is my message. He made it very simple. That's one which appeals to me. He didn't give lectures, he said, this is my life and you follow from that. I think all leaders have to have the courage to show that their life is their message. So what I am saying is, you cannot motivate people by giving a talk on leadership. That's the usual professional way. You give talks, professional workshops, and I also went a leadership workshop in Johns Hopkins. I don't think we get leadership qualities by attending workshops and learning skills. It will help, but what is ultimately needed in this country is people who are practitioners of those values, leadership qualities. They have to practice themselves so that others can see and learn.
Here is an example of self-motivated Doctor cum Superintendent of Gandhi Hospital, Hyderabad, Dr. Ashok Kumar, has taken several small but important initiatives which brought enormous changes in the hospital's functioning. This is clearly motivational leadership in the face of several constraints usually found in a public sector hospital.
First thing I noticed was OP counters there were only 2. I took initiative because in MCA they wanted 7 counters. So there was a space in our OP plug. So I thought, why not have many counters so that patient can get very fast, quick, and go to the consultant. So we made 10 counters. It was possible there, and we have made 10 counters. Now the waiting time is very less, almost less than 1 minute.
కూడా రావడం వల్ల చాలా తక్లీఫ్ అయ్యేది. దూరంకి వెళ్ళి చాలా కూడా సరిగ్గా టైంకి అందకపోయేది. ఇప్పుడు 10 కౌంటర్లు మా సూపరింటెండెంట్ గారు పెట్టాడు కనుక త్వరలో ఎక్కువ ప్రాబ్లం లేకుండా సాల్వ్ అయిపోయింది.
In the OP lab, what I found, there was only one counter, the overcrowding was there. So I thought this is too much crowded, so I made one counter for only for the registration of the lab. There are 3 counters for the sample collections. So now there are 4 counters, 1 for registration, 3 for sample collection, 1 exclusively for the ladies, 2 are for the gents. Importance I gave to emergency medicine department because the most patients come for the emergency, and the emergency medicine is one of the things, and that block is one of the things where I have to focus on, because the reception is there. Earlier only 6 beds were there. Because the input is more in Gandhi Hospital, I made it as 15 beds. Even MCA requires 15 to 20 beds, so I made it to up to 15 beds. Central oxygen and central suction is there, and we have got ECG machine and defibrillator, so it is now almost fully equipped with that one. Mortuary, I did lot of improvement there. When I actually took over as a superintendent, the first thing was there was a smell emanating from them. It is true. So why I inquired in that, and I almost did a research. So then we thought there is a this AC plant was not working. So I thought, I took initiative. I got the AC plant corrected, and also the dead bodies were not cleared. So I talked to the MCH, police commissioner, and also Satyanarayana Foundation. I made it that they have taken over all the bodies and they have cleared the premises, so that they removed the emanation of this thing, and AC also contact. I got the all AC and all rooms clean, and now there is no smell at all. Having 111 dialysis units in Andhra Pradesh. So Gandhi Hospital have now 18 units. It's the biggest in AP, and we have already have a MOU with the Bran company, and they are supplying 18 units of hemodialysis units. And now after 2 months it is fully occupied, and we are having a profits. Last month we have given the 2.9 lakhs to the Bran company as a part of our payment to them. So it was a success here. Arogyasri is one of the boon to the below poverty line patients, and many people got benefited. And earlier we had only one Ramco and then one Arogya Mitra, then one computer operator. The bulk of the load was more, and we are not able to cope up with that load to update all those things, and we are not getting the benefits, either patients or the doctors. So what we did is appointed some 33 computer operators, and we had one very good Ramco who knows the computer knowledge. With that we have updated many people, and we are in we have done a last 2 months we did a business of 9 crores.
After Dr. Ashok Kumar sir, who is the superintendent of our hospital, has taken over this hospital, we had the entire scheme run by an individual. So we have moved from an individual dependent run scheme to a system dependent scheme. This has added a lot of efficiency in the entire working of the scheme. In addition to that, so we have also introduced IT into day-to-day functioning of hospitals, which has also helped us in bringing lot of transparency in the entire functioning of the scheme. Under this Arogyasri scheme, we already have a policy which is existing in the state of Andhra Pradesh, but for various reasons this policy or the concept of this policy was never used in these institutes. So we have been able to utilize the concept of this policy in the procurement of various drugs, disposables and implants, and this has actually helped us kind of bringing in more revenue, which has in turn helped us treating more patients and also helped us develop the infrastructure in the hospital.
Some leaders can brilliantly analyze different aspects of a situation and take decisions. Let's listen to what these leaders have to say about decision making.
My feeling is decision is not about just a yes or no, but creating the environment or modifying the environment that will sustain the decision. And this environment is consisting of people who are for the decision and against the decision, and you have to either build consensus, or sometimes, as we know in health situations, you may not be able to build consensus, but you have to build firewalls to prevent that those who are creating obstacles are not able to affect the decision. Considering 2 or 3 options which seem the way ahead, you choose one rather than the other. You choose maybe the less common one rather than the other. So I feel when you use the word calculation, my feeling is risk should not be taken without some sort of analysis of evidence and options. It should not be in an anarchic situation, in a vacuum, that you just do what you want.
One needs to have a complete background information, like what has happened last year, what has happened the year before that, what has been the antecedents of a particular institution or organization where I have been working. This sort of background information I have always collected wherever I have been working. And that background information is extremely crucial in trying to help you in the decision making process. The determinants of the decision making process for these individuals therefore would be the level of accountability that they have, the sort of harm that would occur if they do not take that decision, the benefit that would occur if they take that decision at that point in time, the sort of authority that they have to take the decision, and ultimately in the final analysis, what they need to do is weigh the benefits of taking that decision vis-a-vis not taking that decision.
Risk-taking behavior is essential for good leadership, but it is more important to take calculated risks. How do leaders take risks?
My experience has been that leadership is also about taking risks, about walking paths that not have been tread before. So sometimes when you have a path in front of you which is what everybody says you should do, and there's a path which may be, maybe that may be another answer, I would suggest take the other part. Because if what other people say, is the right one, the world would have been a much better place already. It doesn't seem to be the better place.
My own life, I found conventional way of life, either going abroad and like many of my friends, or opening a nursing home, private sector hospital. All that I could have done, but I took a adventurous step. When I made this step, my mother was very upset. She wanted to consult an astrologer. There was something wrong with my son. I tear it off, and I said, I decide my future, not the astrologer. So I've gone. My mother is proud of me, but that passion to take it forward, and looking back 30 years, I spent almost 20 years continuously in VR Hills. I never felt a moment of boredom. Every moment I have enjoyed.
Ethical behavior is an integral part of good leadership. Here are the opinions and experience of some of leaders.
Is it health for all or health for those who can pay? To me, there is an ethical issue. This is not an issue of economics. It's not whether a country has enough money or it doesn't have enough money. A country has to decide whether it wants to reach health for all and then build up systems where somebody's ability to pay doesn't become an obstacle to access, or it wants a system which is only going to be based on the market, and everybody who doesn't have money therefore is kept out of the system.
One of the multinational company wanted to give us a free drug, carbamazepine, for experimenting. We said no, and that was very good. Then we could demonstrate that with two cheaper drugs, the phenobarbital and the phenytoin sodium, 95% of the epilepsies could be managed in the rural area, instead of the high-end carbamazepine and sodium valproate, which were needed for a few cases.
Leadership is not something you are going to learn once for all. It is an ever-evolving process of our ideas, talents and skills, and it changes as we do, and it will improve. There is nothing like a right or wrong leadership style. Some are acquired, some are inherited. Some may be useful in some occasions, some may not be useful. It all depends on the situations, how we apply. The most important thing is that we have to identify our own leadership styles, develop them, nurture them consistently. That may be more useful in the long run.
Here are some suggestions from our experts for aspiring leaders.
My suggestion to young people is find the most enjoyable thing that you want to do with your life as a profession, as a career, and build on that. And in the long run, your own enthusiasm, your own expertise, and your own love for that particular job will automatically make you a leader in that.
And I would suggest to all young leaders, create harmony, coach people to do well, build a consensus, and that is the way you will achieve goals quicker and in a more peaceful sort of way.
You have to have 6 traits one leader should have. And what are the 6 traits? Number 1, leader must have a vision. Without a vision, he will not be a leader, he or she. The second one, leader must be able to travel into an unexplored path. Normally, tendency to travel the, well laid out path. Third thing, leader must know how to manage success, most importantly the failure. Fourth point, leader must have courage to take decision. That's our problem today throughout the world. Fifth one, leader should have a nobility in management. Every action of the leader should be transparent. You know what I mean? Leader should work with integrity and succeed with integrity.
Leadership is to guide the people towards right direction.
Leaders are made by the training also, I believe. They are not born, I believe.
Recognize the capabilities of a person. You should take the people together in running one system.
For the health sector, I prefer supporting style of leadership.
Men, money, material, information, these are all the resources we have to use in a proper way.
But in my views, leadership is just not preaching, but it is practicing things.
We should have an objective or a vision.
In my opinion, the leader should have a team building capacity.
We should have the motivation power. By that only we can motivate the other people and get the things done.
Our leader was a good knowledge person and kind enough.
Should be natural.
Commitments toward the professional systems.
Clear vision, creative ideas, achievement, high confidence.
Leadership to me is like Mahatma Gandhi. He should be a good listener. He should be a good supportive person. He should have good motivating skills.
And I love the way, the Gandhiji's way.
Leader is one who possesses a sustained sincerity, and he should have the ability to make more leaders. I think humility is one of the best aspects a leader should possess.